Children's Hospital of Philadelphia has long been ranked as one of the finest children's hospitals in the country. In our Women to Watch at CHOP series, you'll meet some of these amazing women working to preserve this best-in-class institution. Let's meet Dr. Susan Furth, Executive Vice President and Chief Scientific Officer at CHOP. Susan, welcome to the show.
Thank you. So pleased to be here.
It's great to have you. I thought we would open up this segment and just allow you to briefly introduce yourself to our viewers and tell them a little bit about your role at Children's Hospital of Philadelphia.
Great. Well, again, thank you for having me. My name is Susan Furth. I'm the Chief Scientific Officer and Executive Vice President at the Research Institute at Children's Hospital of Philadelphia. I trained as a pediatrician and then a physician scientist. And in my current role as the Chief Scientific Officer, I direct the research agenda and oversee research activities of the remarkably talented investigators that we have across the spectrum of laboratory-based research all the way to community-based research. So I feel like I have the best job in the world because I get to oversee these really passionate and creative investigators who are really using their skills to solve the problems that face our patients and their families, develop new diagnostics and treatments and evidence-based medicine that can really improve outcomes for children.
I'm curious what inspired you to pursue science?
I use this line, which I got from, there's a wonderful book, The Emperor of All Maladies by Siddhartha Mukherjee. And in there, he's talking about, how people end up with cancer. But I think it applies to a lot of the things that we end up doing. And for me, that line is genes, environment, luck, and chance. And when I talk about genes, I come from my grandfather was a cancer researcher. He was a medical doctor, but he used to say he was a mouse doctor because it was the time when they were breeding mice that would then develop cancer so they could do research. And then my grandmother, his wife, was a pediatrician, and I have her medical degree from 1922 from Charles University in Prague. And wow. I don't think there were many women doing that back then.
Yeah.
And then environment, my father was a researcher as well, and my mother a nurse. And that led me to want to go into medicine. And then the luck was that I went to the University of Pennsylvania School of Medicine, had wonderful professors who were inspirational. And I remember them telling me the problem is that half of what we teach you is wrong. The problem is we just don't know which half. And then when I went out to first practice medicine after my pediatric training, I worked on the Navajo reservation in the Indian Health Service. And I was practicing the things I'd been taught. And I found that often what I'd been taught didn't seem to apply to the populations that I was taking care of. And we had limited diagnostics and therapeutics. So I went back to train in science and research methods and clinical investigation in order to better answer those questions and develop better ways to diagnose and treat children.
Wow. So it's clearly genetic in your case, but also
yes, there's a big element of that.
Yeah, and opportunities. Tell me what specifically in today's world where I would say things change so drastically and swiftly, what is the greatest challenge you face in your role today?
I think you already alluded to it. I think navigating change and leading people through change are the biggest challenges. A couple of examples, in pediatrics, we have many women physicians and investigators, and also just people of parenting age, so people with young families, regardless of gender. And for example, the COVID pandemic, where our environment changed dramatically, people who've been navigating that sometimes precarious work-life integration when you have a young family or older parents, being thrown into not having childcare at home or not being able to navigate those things, helping creating an environment that could support people through that. That was one of the biggest challenges. There are other changes that we navigate with example, now currently we always think about opportunities for funding of research, and when the external environment, if there's less investment in research, whether that's from investors or biotech or funding from foundations and the NIH, helping build resilient communities that can navigate through change. Some of those are the biggest challenges that we face.
I understand, mentoring is very important to you and something you see great value in. And I, what is something that you often say to your mentees?
I was very fortunate to have wonderful mentors, and it has been, I try to pay that forward. It's been a big part of who I am and what I try to do for my mentees. My assistant once found this fortune cookie uh, um, um, little that I one of those little messages that you get in a fortune cookie that said that she gave to me, and I have on my computer. It says your hindsight can be someone else's foresight. So I tell my mentees about things that I've done, things that didn't work out the way I thought they did or should, and what I learned from that, and to help them understand your path is not always direct. But if you
Yes.
learn from your experiences and you build a supportive community around you, people that you trust and can go to for advice and guidance, and seek their feedback and incorporate that feedback, that it will really benefit you in the long run.
One of the goal I would say of CHOP is for every child to have a chance at a healthy future. And how does the Research Institute specifically support and help in that goal?
One of our strategic imperatives as an enterprise is to really promote research driven precision medicine, so diagnostics and therapeutics that are really tailored to an individual's circumstance. And I always add to that research driven precision medicine that this has to be research driven precision medicine for everyone. So we've invested in programs around health equity research methods, and making sure that as we are pursuing our research and discovery, that we're thinking about how our questions apply to different populations, whether it's where they live, if they're rural or urban, or what their social determinants of health are. So we're trying to incorporate thinking broadly about improving child health to all populations. So we want to help children who are around the world and also in our backyard.
I'm going to leave you with one last question. Can you tell me, what are you most proud of as a woman scientist in the world today?
Well, I'm really proud of the people I've mentored. It's really wonderful to see that, people talk about standing on the shoulders of people before you, and being able to see the people you've mentored achieve great heights. I'm very proud of that. I'm proud of, as a woman and a mother and also research scientist, I'm very proud of my career, but I'm proud of what my children have been able to come and to accomplish, and that um, I think of a card that one of my daughters gave me that has on the front of it a little girl with boxing gloves, and it says, "You are my hero." So I'm proud
Oh,
of being able to balance those things.
yeah. Well, you're doing incredibly important work, and thank you for doing it. And I wish you continued success.
Thank you so much. Thanks for taking the time. I really appreciate it.
Thanks so much to Susan Furth. Stay tuned for more Women to Watch at CHOP.